So thanks, Dave. So tell me a little bit about what's going on here today.
This is our annual flu shootout. Every year we provide this event to prepare for the upcoming flu season. We do it as kind of a mass vaccination exercise to practice our emergency response plans.
Okay. So a number of questions come up about the flu shot. Should I get one? Should I not? Looks like about 40% of adults typically get one each year. Obviously from the health departments, I'm sure you'd like to see that number raised up a little bit. But here are some of the questions that I have found that people often ask, and some of the things that maybe get in the way of them actually going through and doing it. So first off, can getting a flu shot give you the flu?
It can't, because it's an inactivated virus. So it's based on the original virus of the top 3 viruses that we think will be going around this year. They inactivate it, your immune system still recognizes it. Now, you may develop mild flu symptoms after the vaccine as your body builds up immunity, but you can't actually contract the flu from a shot.
Okay. All right. How much does it cost?
It's $20, cash, check, or credit card. We do take a lot of insurances as well, so there would be no charge in that situation.
So a lot of insurances cover flu shots now as
They
part
do,
of preventative medicine type thing. Okay. All right. One thing I saw quite a bit is that it's better to build up your immune system by just getting the flu, rather than doing this and stopping your immune system from getting that exercise, I guess.
And that's understandable. A lot of viruses, you can build up your immunity when you get the actual disease. The thing to remember, though, is that influenza, or the flu, which we kind of take for granted a lot of the times, every year is the #1 killer as far as infectious diseases are concerned. So every year between 20 up to 40,000 people die from the flu or its complications, including pneumonia.
Okay. You mentioned those numbers. A lot of this comes from the CDC. I also see a lot of questions about their numbers. How certain are we, I guess, at this point that the shots are effective? Do we have a number, an estimate that we put on how, how much you're reducing your risk from getting the flu at this point?
Right, that's a good question. So no medical intervention or vaccine is 100% effective, and there's no way to know exactly for sure, but the estimate right now is that a flu vaccine, if it matches the viruses going around that year, is about maybe 60 to 75% effective as far as protection.
And there is research going back. Looks like we've been doing this for years, decades. And so, how certain are we at this point about the science? Is this comparable to what we know about smoking and how it relates to lung cancer and other health maladies?
It is pretty solid. We've had flu vaccine, like you say, for many years. They're refining it all the time. In fact, in the next few years, you'll see some pretty interesting developments as far as a vaccine that's more effective, but is not grown in the eggs. It's cell-based. They're also working on a vaccine where you get it once and it protects against the flu the rest of your life. So interesting developments coming up. The science so far has been pretty solid. Like I say, it's not 100% effective, but it's probably one of the ways, if not the best way, to prevent yourself from getting the flu every year.
One of the things I saw they're working on is a shot that you wouldn't have to do every year. At this point, that is the recommendation. But why? Why do we need to come back every year?
The flu virus in particular mutates rapidly. It's one of those that's designed to change every year. It affects a lot of people. So every year during the flu season, the strains we see going around, even if it's the same strain, has mutated a little bit. So for instance, the H1N1 flu that came around during the pandemic, we still vaccinate every year against it, but it's changed a little bit every year. So we try to stay on top of it that way.
All right. Are there other harmful ingredients in the vaccine? I saw this a lot too. Preservatives, egg proteins, synthetic compounds that are known to have other harmful effects.
Right, sure. No harmful effects that we know of. The egg protein is interesting because if you have an allergy to eggs, you could have a reaction. So we tell, as far as people that should not get the flu shot, it would be people who are allergic to eggs. People are concerned about preservatives. They still, in some vaccines, use thimerosal, which is a form of mercury. The amount of mercury you're exposed to in a flu shot is about the same you get in a half of a tuna fish sandwich. So we're talking about quantity here.
Okay.
It's a tiny minute amount, and it's well within safety limits.
Okay. All right. It's all good stuff, Dave. Thanks. So, how common are serious allergic reactions? Can you get them even if you don't have a known egg allergy?
Not that we know of. Anytime you get a shot or have any type of medical intervention, a certain amount of people will have an illness or something right after that they would have gotten anyway. So sometimes it's hard to tell. We don't know of any really serious interactions other than people that might have pain or swelling on the side of the injection. But again, it's pretty safe.
Okay. All right. If you're young and healthy, you're someone in your 20s or 30s, You know, you say, I never get the flu shot. Why should you bother? I did read that oftentimes you can carry the virus,
Right.
not see any symptoms.
Oh, absolutely. So yeah, that's a good reason to think, why do I even need the flu shot? One thing to remember is vaccinations aren't just for you, they're for the community. So the more people that get vaccinated, even if they're pretty healthy, you protect people that couldn't get vaccinated or maybe don't have the 100% coverage of the vaccine. So the elderly, young people, pregnant women, people with compromised immune systems, they're the more vulnerable ones that we're trying to protect. So you being vaccinated, even if you don't get sick, you're helping protect and immunize the whole community.
Okay. And then, of course, the one that always comes up, especially around here, is this is a big pharma, flu phobia type of thing. That this is just a way to sell vaccinations. Do you have any message to people who have concerns about the real need for this? Obviously the health community is generally behind it. Can you talk a little bit about why?
Like why the health community is
behind it?
I think what it comes down to again is, since the advent of vaccinations, we've seen a lot of diseases either be eliminated like smallpox or almost eliminated like polio, and the next target is measles. So again, a lot of these diseases historically have caused a lot of death, injury, misery. So we consider vaccines one of the great benefits of modern public health. It's not a perfect intervention, it's not 100% effective, but when you look at again the amount of hospitalizations and even deaths every year from influenza specifically, it's a great preventive. That's what we're looking at. And really, we don't make a lot of money off flu shots, but it's something we think is very important. So every year we do try to push it, because flu season will be here in a couple of months. We want to prevent as many hospitalizations and deaths as possible.
Okay. Perfect. Well, thanks a lot, Dave.
Yeah.